My name is Cassandra Lawrence, and this is my teaching and learning strategy video for N5310, Teaching and Learning Theories and Strategies for Nurse Educator at the University of Texas at Arlington. Today I will be teaching two non-healthcare students, Chantel Williams and Robert Lawrence, how to administer and score the PHQ9, or the Patient Health Questionnaire 9, which is a depression screening tool. As we know, depression affects many of us in one capacity or another. According to the World Health Organization, by 2020, depression will be the second among all disorders that causes disability for all age groups. You might ask, what is depression? Is it life-threatening? According to the Beck Depression Inventory 2, or the BDI-2 depression scale, it can constitute a variety of symptoms from something as simple as sadness and loss of interest to suicidal thoughts. Depression can lead to long-term sickness and deterioration, and ultimately morbidity and mortality. Therefore, early identification, treatment, and referral by healthcare personnel is critical. The Patient Health Questionnaire, or the PHQ9, is a 9-question self-reporting screening tool that is widely used in many healthcare settings today. It's used because it's quick to administer, it's available in multiple languages, and it's very cost-effective. Above all, it's proven to be reliable and a valid tool in identifying depression. When completing the screening, it's going to be important that you remember that the first 2 questions are designed so that if the client scores less than 2, it constitutes a negative screen and no further questions are needed to be completed. Otherwise, if the score is higher than that, you'll need to complete all of the questions on the questionnaire. My teaching strategy. I will use simulation as the teaching strategy because it is student-centered and it allows for evaluation and assessment. A scenario depicting role play will be used. By the end of the lesson, the students should be able to understand the importance of early screening and identification of depression. They should be able to explain the use of the patient health questionnaire, or the PHQ9, and administer the PHQ9 to identify individuals who might be at risk. At this time, we're going to have a role play for Chantel Williams and Robert Lawrence.
Hello, Mr. Williams. Thank you for visiting JPS today. My name is Chantel Williams. Today I will be completing a depression screening questionnaire with you to identify if you have depression symptoms so that the doctor can check the appropriate treatment plan referral if needed. The screening is quick and will only take a few minutes. Please identify if you have had any of the following symptoms over the past 2 weeks. Little interest or pleasure in doing things, not at all, several days, more than half days, or nearly every day.
Several days.
Feeling down, depressed, or hopeless, not at all, several days, more than half the days, or nearly every day.
Several days.
Trouble falling asleep, staying asleep, or sleeping too much, not at all, several days, more than half the days, or nearly every day.
More than half the days.
Feeling tired or having little energy, not at all, several days, more than half the days, or nearly every day.
More than half the days.
Poor appetite or overeating, not at all, several days, more than half the days, or nearly every day.
Not at all.
Feeling bad about yourself or that your failure to, or have let yourself or your family down, not at all, several days, more than half the days, or nearly every day.
Not at all.
Trouble concentrating on things such as reading the newspaper or watching television, not at all, several days, more than half the days, or nearly every day.
Several days.
Okay, moving or speaking so slowly that the other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual, not at all, several days, more than half the days, or nearly every day.
Not at all.
And thoughts that you would be better off dead or hurting yourself in some way, not at all, several days, more than half the days, or nearly every day.
Not at all.
If you have checked off any problems, how difficult have those problems made it for you to do your work? Take care of things at home or get along with other people.
Not difficult at all.
Okay, thank you, and this concludes the patient health questionnaire.
Hello, Ms. Williams. Thank you for visiting our clinic today. My name is Robert Lawrence, and I will be completing a depression screening questionnaire with you today to identify if you have any depression symptoms so that the doctor can decide on the appropriate treatment or plan or referral if needed. This screening will only take a few minutes. Please identify if you have had any of the following symptoms over the past 2 weeks. Over the past 2 weeks, how often have you been bothered by any of the following problems? Little interest or pleasure in doing things? Not at all. Several days, more than half days, nearly every day.
Not at all.
Feeling down, depressed, or hopeless? Not at all. Several days, more than half the days, nearly every day.
Not at all.
Thank you, Mrs. Williams. This completes our screening. The doctor will be with you shortly.
And so in observing the questionnaires and in that role play, you were able to see where one had to be scored and the other one ended at 2 questions. And so it's really important that you understand, number one, what depression is and why it's important to screen for it. What is the purpose of the PHQ9? And can either of you tell me what the purpose is of the PHQ9?
To measure the patient's depression.
Correct, thank you. And you were both able to successfully score the PHQ9, and in scoring that, you were able to, that will go to the provider as for further testing. Thank you.